All right, we are live. Hello, everyone, and welcome once again to Conversations that Help You Live Long and Well. We're talking about constipation, confusion, the role of fiber in gut health. Now, I want you to type in the chat help if constipation has ever been an issue for you. Before we start, if constipation has ever been an issue for you, go ahead and type help. I'm going to type it too because it's happened before. Uh, and if this topic, of course, has ever affected you, yes, in the comments. So I know I'm talking to the right people and that this is a meaningful conversation for you. Well, I'm going to be taking notes because we have an amazing physician here with us. So I'm also typing yes. And of course, if you're watching us live, hashtag live. If you're watching us replay, hashtag replay. I'm excited to be having this conversation. Constipation is common, but it's not normal. And so we brought on today Dr. Francis Horenstein. Did I pronounce that right?
Horenstein.
Horenstein. All right, Dr. Horenstein. We're having conversations on constipation. Doc, thank you so much for coming on. I know you're busy. I appreciate you taking your time to meet with us and bless our listeners.
Oh, thank you. It's my pleasure.
All right, awesome. So, Dr. Francis is a colleague of mine. We're in a class together. She's a phenomenal physician. She's also the founder of DigestWell Health. She's also a lifestyle integrated GI practice serving the Columbus, Ohio region. For those of you who are listening or watching, she's a good one to connect with. I'm going to let her introduce herself as well. So, Doc, if you could tell us about who you are and what you do and why you do the things you do. I see you do the preventive focus strategies and lifestyle integrative medicine. So tell me, who you are, what you do, and why you do the things that you do.
Yes, so yes, I'm Frances Horenstein. I'm a gastroenterologist, board certified, and I've been in private practice for 2 years now. So it's we as a physician, we actually we talk about like lifestyle, but most likely often more in passing because we are more focused on symptom control and trying to diagnose
Mhm.
patients. But as we realize later on that a lot of the things that our patients complain about, or even our own bodily complaints, are associated with lifestyle, right? Like the way we live, what we consume, the stresses that we are exposed to. And we have to tie those together, like what our symptoms are, how we treat our symptoms, and how we change our lifestyle as well, so that we can live healthy life.
Okay. All right. Awesome. So that's why you decided to do that. As if going to medicine and medical school and studying gastroenterology and doing all the things was not enough. You added that. I like it. I like it. I'm also lifestyle board and I love it. Um, but Doc, our first question is, what exactly is constipation? Some people feel like, well, I've always pooped once a week, and that's normal for me. But let's start simple. What exactly is constipation, medically speaking?
So, medically speaking, and in the most simplest of terms, constipation really is um, infrequency of stool, right? Like the definition is having bowel movements less than 3 times a week. There's a change in the quality of your stool. It's harder to pass, and you may not have a stool regularly and pass it spontaneously. So some people may need to use laxatives for that, just to have a bowel movement. And of course, these are also associated with symptoms associated with being constipated. It's either you're bloated, you're gassy, you're feeling heavy, having that heaviness or discomfort, like especially all over your abdomen or lower part of the abdomen.
Okay. Now, is constipation a big deal? Yes, the heaviness, and yeah, you literally work around with crap. But is there? Because I've had clients tell me, yeah, it's not a big deal. This is just my norm. Are there some dangers to being constipated? What would you say to that, doc?
So the So there are people who experience constipation sporadically. We experience that as well. Like if we are not in the right setting, there's some people like when they travel, like they get constipated and they're kind of like not doing their routine and not eating what they normally eat. They become
Mm-hmm.
constipated. So there will be a change in the character of the stool that it's a little bit harder to pass. Um, but one of the things that we have to watch out for is chronicity. So that's when you are constipated and not having spontaneous bowel movement and having it less than 3 times a week and using laxatives for over 3 months. And that's really like something that you shouldn't ignore and probably discuss it with your healthcare provider.
Okay, you gotta let the crap go. Literally, you gotta let it go. So, gotta talk to your doctor if you're holding on to it. Okay,
Yes,
in
yes,
life and other,
that's
you gotta
true.
let go. All right. Why do you think so many people struggle with this? I know you alluded to some of the causes. You mentioned water, but for those who are listening, who are like from a preventive standpoint, how can why do people struggle with it? And then we could talk about what people can do to prevent.
So one thing, the reason why people struggle about it is um, there is a feeling that it's normal, right? It's probably like something that's normal and something that will go away on its own. And true enough, right? That's probably majority of people. And sometimes like talking about digestive symptoms will be taboo too. It's that something, it's very personal that people don't like just like talk about with their friends or their family. And again, that's the feeling that, oh, this is probably normal. What I'm feeling is probably like past. And the reason why it's so common is our diets are not really very fiber rich, like especially with the way we live, our lifestyle, like wherein we live busy lives, and a lot of us don't really pay attention to the things that we eat, or sometimes even just the habit of going to the bathroom. There's a lot of people who feel that they need to go to the bathroom, but they hold it because they're probably
Mhm.
on their way to work or about to start their class, about to be somewhere. So a lot of when you miss that opportunity to have that bowel movement, a lot of times it may not come again.
Mm.
And
Okay,
that's,
that's
yeah,
a
that's
big
like a
deal.
call of stool. That's a big deal, right?
That's a big deal. That's a big deal. Now, Doc, I want to talk about that a little bit because I know some people, may not, I may or may not know them, that will not go to the bathroom in a public place or will
Mm-hmm.
actually wait to get home. So for those who are a little like, oh man, I really have always been like this. You talked about holding your poop, you miss out the opportunity when you don't poop where you should
Yes.
poop. What would you say to that person who's a little bathroom shy? And literally, we hold it till they get home.
Uh, So, as a gastroenterologist, and so I see a lot of patients who already have constipation to begin with. Um, a lot of them fit a certain demographic, right? Or a certain profession. Um, I see it common in teachers and nurses.
Mhm.
So, again, like these are people in our society who have like start their day very early, so they probably really have no time. They're probably like grabbing and going, right? They grab breakfast and go run. And again, this is the kind of profession who do not have the time during the day to, if they feel like they need to go to the bathroom, they may not have that, like they can't take off and just like take a break in the middle of their class. Um, so for those who are in that situation, one advice is to try to have a morning routine.
Hmm.
Like really take the time to eat breakfast because like our gut needs to wake up too. And really like that act of like putting food in your mouth like wakes like puts that gut into your thing that movement mode where things will just like move along. So if we take that time and hopefully like have undergo that cycle, wake up our GI tract, and hopefully we will elicit that like massive movement and we will have a bowel movement. Um, if you are in a situation, especially if you are feeling that, if you can, then take a break and try to really take advantage of that, like that call to stool, that urge to have a bowel movement and to not ignore it. It may be hard, but it is more beneficial to listen to that call of our body rather than ignoring it.
Mm-hmm. I like that. Listen to nature's call. And for those who may be like, well, I don't like to poop in public, you can get some poop-pourri. Mm-hmm. Spray a little bit before you poop. It helps with the smell. It's supposed to
That's
stink.
really
Right,
good
Doc?
advice. Yeah.
It's supposed to stink. So let's demystify because you're harming yourself when you don't or you hold on to
Hmm.
poop. Literally, you're holding on to crap. You got to let it go. All right, Doc, thank you so much for that. My next question is fiber. You mentioned, fiber as something that's important for gut health and for also minimizing the risk of constipation. Why do you think that people struggle with getting enough fiber?
People struggle for with fiber is because their fiber is very it's complex, right? So not all foods, not so we often advise our patients to eat fruits and vegetables. Um,
Mm-hmm.
when we eat fruits and vegetables, it's also very filling. So not so if we think we're consuming enough fiber, we may actually not. But you eat an apple and you're already so full and you cannot eat anymore. Um, and not to mention, we do have other sources of calories. We do have other things that we eat.
Mm-hmm.
Especially in this day and age, people are very busy. So we have a lot of things that we consume that will give us calories, but will not give us fiber or the nutrients that we actually need. Like it's easy for us to grab a bag of chips or eat some crackers. And I have to mention too that the things that we perceive that are generally healthy may not contain fiber. And I'll give an example, like so yogurt, right? It's very healthy. It has
Mm-hmm.
probiotics, but it has zero fiber.
Yeah.
Um, so I eat yogurt myself in the morning, but I yeah, but now like I think about it that oh, if I ate yogurt today in the morning and that's the only thing I ate, then I had zero fiber to start my day already.
Mm.
And with that fiber requirement being like 25 grams for females and reaching at with the recommended being up to 35 grams, that's really hard to meet if by for people who skip meals and for people who don't eat breakfast
Hmm.
or those who
So what
just
are creative
drink Coke.
what are creative ways to add fiber? And can we give more examples of fiber? You mentioned fruits and vegetables.
Fruits and
Um,
vegetables, yeah. Whole grains,
okay.
oats, bran cereal, that's one. Just examples. Beans, legumes are good sources of fiber. Chia is very popular. And
Yep.
again,
I'm a
also
big
like
fan.
very fiber dense. So an example, like you will see like in some cafes, like especially the smaller ones, they would sell like chia pudding for breakfast. So those are good options.
Awesome. Thank you so much for highlighting this. I had to Google. There are over 200 types of beans, and they're a good source also of protein too. So
Yeah.
fiber, you got to see the fiber. You got to think the fiber to add the fiber. And I love that you mentioned the yogurt. You can put the chia seed. There's a brand I use, Live
Hmm.
Pure, with the Mila. It's micro cut. It looks like sand. So the kids do that in their yogurt in the morning. It keeps them full and it gives sustainable energy throughout the day because the fiber sits in your stomach and it helps with gut health and it's a brain food too. For someone who's watching who says, well, when I eat a lot of like I wasn't eating fruits and vegetables And one day I talked to my GI doctor and they said I got to eat more fruits and vegetables. So I went and ate a couple of salads and I felt like crap. Like they felt
Yes.
really bad. Um, it felt bloated. And so they decided that, well, maybe fruits and vegetables are not good for everyone. Now, I know that we can't say this, as a blanket statement, but what would you say to that person who's working to increase the amount of fiber in their diet?
So for those who are trying to increase, try to increase it slowly. The recommendation is to just try to increase it about 5 grams every couple of days. Um, and that's a good benchmark, like just making yourself get used to consuming more fiber, and that also feeds your gut microbiome, feed your good bacteria with good things. And why is 5 grams like reasonable? We're trying to build healthy habits, and a lot of times like it needs a lot of thought process to it too, like what we're going to add. And because we're trying to build healthy habits, we want to consume the things that we actually want to eat. Because otherwise, if you don't want to eat your fiber source, if you're not happy with your fiber source, then you will just abandon it, right? Like you are not encouraged or you are not motivated to consume it or eat it.
I like that. Like finding the fiber source, genuine fiber source that you like. Okay.
Mhm.
All right. And there are a lot of options. That's a good one. I'll stop forcing my kids to eat the chia seeds. I'll have them pick.
Yes, I've talked to some patients, right? And I may be an apple eater, but if the patient says like, oh, I don't like the act of chewing an apple, it just takes so long. And so, of course, like you will have to find like something that's easier for them and something that they would like to eat.
Yeah, like sliced apples. You cut it in pieces so it's smaller and easier to eat.
Smaller.
All right, let's talk fixing. So, what are common mistakes that you see that people make when trying to fix constipation?
Okay. So one is we talk about not eating enough fiber or adding it too fast. So to fix constipation, the first thing is we have to review what our diet is like, especially if we're going to attack it in the dietary front, in the lifestyle, get a lifestyle process going there. So trying to increase fiber, 5 grams every 3 to 5 days, and really like learning what are the fiber dense fruits and vegetables that you would like to eat and you will be happy eating. Um, so one common mistake is adding it too fast, like trying to meet like 25 grams. Please do not like meet 25 grams one day and then the next day you're just like so full and like I'm done. I can't eat like 5 apples a day, or I cannot eat like an apple every single day, or and eat a banana every single day if you're not really a banana eater. So again, like the first 2 weeks will probably be, I would say, the experimentation phase, like trying to learn, like, oh, what do I really want to eat? Do I like to eat oatmeal some days and add chia seeds to it and have a handful of berries to it? And then read the labels too. There are apps available that will tell you like how much fiber it will be in one serving, like a half a cup of oatmeal or a half a cup of yogurt and half a cup of berries.
Oh,
So that's what be my advice. Another mistake is not consuming enough fluids, not drinking enough water. So that goes hand in hand, adding fiber and drinking enough water.
awesome. A lot of gems you dropped here. And I love it. Dr. Petrina is here. She said, we love fiber. Yes, we do. We love fiber. Fiber is good. And I'm glad you were mentioning apps that can help with kind of telling you how much is what, because someone is watching and they're like, and for those of you who are watching, if this is resonating with you, do you type fiber, food fiber in the comment? Type fiber, and you can share your favorite fiber. Okay. But one of the things
Yes,
you
I want to
mentioned is the
see what your
5 gram.
favorite fiber.
Yeah, my favorite fiber I think is beans. I like beans. I like beans.
Is it black beans
But
in particular or some other kind of
I
beans?
like it's a honey beans. It's very common in Nigeria and parts
Uh-huh.
of Africa. It's a sweeter, it's almost like the black eyed beans, but sweeter and
Okay.
brown color. It has a honey taste, like well, it's not sweet, but it tastes sweeter than most beans. So I enjoy eating that. But give me an example, like 5 gram fiber relative to an apple. How
Mhm.
how much like how much fiber is an apple, would you say?
So a medium-sized apple has 4 grams. So that's why I have it in my head already, because a medium-sized apple
Mhm.
will have 4 grams and a medium-sized banana will have 4 grams.
Okay,
So I
so there you
split it
have it.
into four because then I'm closer to 25. So that's actually like my benchmark. So like
Hmm.
if I eat a banana and an apple, so I already got 8 grams in, then I'll probably like have four more servings. Um, half an avocado actually has 5 grams of fiber.
Really?
Yes. So I also just found that about a week ago that it actually has like fiber, because I was consuming avocado more for the protein because it's also protein
Protein and
dense.
healthy fat. Yes.
Yes. But yeah,
Oh, wow.
apparently it also has like just half of it will have 5 grams, and that's what I can normally consume too. So if you split it into those fours, it will actually be the 25 grams will be seem to be more achievable. Because now if you add snacks there, if you add like half a cup or a handful of nuts, that will also
Hmm.
give you another 4 or 5 grams.
Oh, I like that.
And then, yeah, if you eat your dinner, you have beans there, like whether green beans or black beans. And if you have the proper serving, then you can meet like that, like 25 grams of fiber or even more.
I like that. And Miss Martin shared that she likes pinto beans, honey beans, and black eyed peas and beans. Awesome. I actually like the green peas. You just steam it and eat a real sweet, a very nice sweet snack. And I've learned something about avocados. My daughter likes the guacamole with the carrots. So she do the carrots and the guacamole. So fiber and fiber. I like it. Doesn't sound so hard, Doc. I like it. I like it. All right. Now, other tips for gut health. Any other easy, doc, emphasis on easy everyday tools that help with gut health as we wrap up?
So as we wrap up, you did mention at the beginning, we talked about ignoring the urge to go is again something very important in patients who eventually develop constipation later in life. And I want to talk about that because if you ignore the call to have a bowel movement, the colon, the function of it is absorption mostly, right? It absorbs water for us to have a solid bowel movement. So the longer the stool stays, then the harder it becomes, and that's why like it becomes harder to pass. So like you gave the advice of like bringing potpourri or like bringing like most public toilets like have a seating area like a seat cover so that it would be like more convenient for all of us. But other than that, if you work in an office or if you work in an environment where you could find a bathroom probably that's like a little isolated, where you could have privacy,
Mhm.
and so that it would be less bothersome for you to, and you know where to go if the call to have a bowel movement comes.
All right, I like that. When the call comes, make sure you answer. Yes. So now for someone who's already had, let's say, they're already backed up, they're constipated, and they wonder, well, if I add fiber now, yes, that's preventative, but how are there easy foods, everyday foods that can help with going? Um, people say pear, kiwi sometimes, what other foods would you say kind of help with someone who's like, okay, I'm already backed up. I will work on the fiber. I agree. But what can I do to kind of help with,
Mhm.
aside from seeing my GI doctor?
So a couple of things. This is like very, very old and has been used for a very long time is prune juice.
Mm-hmm.
We probably heard from grandparents when they would drink prune juice, which has sorbitol and induces like movement and digestion. So it really induces colon motility.
Okay, yeah, prune juice tastes nasty, doc.
Prune juice
It's
and
rough.
prunes also actually like those are like equivalent in terms of recommendation. There was old literature that actually compared Miralax, which
Hmm.
is a laxative, and prune juice, um, and it showed that prune juice is not very much inferior to using an osmotic laxative like Miralax.
Oh wow. Okay. We put a little honey in it and make it taste good. Add some pear. I like the Bartlett pears. I find that Bartlett pears also help. I've had recommended that too for a few clients. It kind of helps as long as they don't
Yeah.
have IBS. But Doc, thank you so much. This has been very rich. For those who are watching, what's one or two things you're going to start to do based on this conversation? If you're if you're obliged to share, would like to share with us, please go ahead and put. I'm going to see avocados a lot more than I used to. I thought it was more protein and healthy fat, but it has fiber. Half has 5 grams, and then 25 grams for women in general a day at least is recommended. So get our fiber on. But Doc, thank you so much for coming. For someone who's watching, who's like, or who's listening, thank you so much. And they're wondering where can they connect with you? Where else can they get this kind of information that integrates not just the medicine, but also lifestyle tips and integrative health tips as well? Doc, where can people find you?
Yes, thank you for joining us. I'm Frances Horenstein. My practice is DigestWell Health. I'm on Facebook also, so I post like little bits of information and guidelines. I talk about fiber, some GI symptoms as well. And hopefully you will follow me on Facebook. And just remember, yeah, increase fiber slowly, increase your consumption of fluids. And what I didn't touch on is movement. Like movement also aids in digestion and the motility of our colon. So integrating like frequent spurts of movement throughout the day will definitely help as well.
You heard her. Exercise, drink more water, add fiber, but increase it slowly, and have a good morning routine that includes letting go of crap. I love it. I'm sure you have a lot of poop jokes. A lot of puns. Oh, thank you so much. And I've put her information in the comment section. So her website and also where to find her on Facebook. Please follow her. Lots of useful information. If you just take one thing and implement consistently, you will start to see
Yeah.
the difference. Thank you all for watching. As always, please like, subscribe, go ahead and like and follow if you haven't done so already. That's my ask for you this afternoon. And please also follow Dr. Francis, I'm sorry, so you can get more information that helps you feel better. And real quick, I'm going to ask this question because I share this a lot. What is the average colon?
What's that, Dr. Tolo?
Like yeah, how long is the average? Like how long is your gut from the small intestine to the? Because I have an idea and I share with patients like that's you're literally full of crap that long. But how long is it?
So average, it's 6 feet.
Okay, so that's a whole length. That's a tall.
So don't fill
That's
it up with
wow. That's
stool. So it is important for us to go every day because
please
that
don't.
will be a lot.
Yeah, 6 feet. Wow, that's tall. It's really tall. All right, good to
Mhm.
know. I'll use that fact when I that fun fact when I encourage people to help develop better gut habits. Thank you so much for
Yes.
coming, Doc. I appreciate you. We'll do this again. This was very, very helpful.
Yeah, thank you. Thank you everyone for staying with us. And hopefully you found this helpful.
All right, everyone, have a good one. As always, sharing is caring. Make sure you share. And as always, if you or anyone you know is looking for an awesome, a thorough, and compassionate family physician that will have poop conversations even to help you live long and well. I am she. Have a good one. God bless.
Bye.